Welcome back to the ninth annual CR Arthritis event at the Canadian Rheumatology Association scientific meeting, as well as the AHPA, or the Arthritis Health Professions Alliance pre-course. Today, I am joined by Jeff Beach, who's the Executive Director of the Canadian Spondylitis Association, or CSA, which is a nonprofit charitable organization dedicated to improving the lives of Canadians, those especially that are living with spondyloarthritis. Jeff, it is so great to have you, and I cannot wait for a conversation.
Thanks very much, Ellen. We really appreciate the opportunity to be here with you today, and very happy to have this conversation with you as well.
Jeff, can you share a little bit about yourself, your background? I know you have extensive many years in kind of the field of working with nonprofits, as well as tell us a little bit about your role at the Canadian Spondylitis Association.
Sure. So I've been the executive director of the Canadian Spondylitis Association, or CSA, for about a year now, since early 2022. Prior to that, as you alluded to, I've had a long career. It makes me sound old when I say that sometimes, but I've had a long career in the nonprofit sector, mostly with health related organizations, patient associations. So my most recent experience before coming to CSA was as part of the leadership team with Cystic Fibrosis Canada. And I was really fortunate to be there. I was there for about 7 years, and I was there during the time that cystic fibrosis medications were introduced for patients that were disease-modifying drugs, life-changing, life-saving drugs. So it was such an exciting time for us in the cystic fibrosis community at that time. And now working with the spondyloarthritis community, it's really exciting to see how the prognosis and the treatment options that are available for Canadians living with spondyloarthritis continue to evolve as we understand more about the disease. And I'm really passionate and very excited to be working with this community. And going forward, I think the future will continue to be brighter for people with spondyloarthritis. Throughout my career, I've been with, as I said, different organizations, but I think it's worth mentioning that in the late 90s, I was with the Arthritis Society. In Southwestern Ontario, I was the community development associate, so kind of a one-person show in Southwestern Ontario at that point in time. But it was great to reconnect, I guess, in a way with the rheumatology and arthritis community through this position that I have now with CSA.
Jeff, it does really warm my heart, and the story of disease modifying drugs, and seeing that medical innovation, and now you yourself are leading the advocacy and innovation, right? I think there's now a push to advocate and to innovate in that space. Can you share with us a little bit about some of the new and exciting developments at the CSA?
So in terms of CSA, we're one of the most exciting things for us really is that we're about to change our name. So we'll still be known as the CSA, but this month in February 2023, we are changing our name to the Canadian Spondyloarthritis Association rather than Canadian Spondylitis Association. So some may say, it's a subtle difference, but it really is important because we recognize the fact that the global terminology around in the medical community throughout the world is changing, referring to spondyloarthritis as opposed to spondylitis, ankylosing spondylitis. Those diseases are all part of that umbrella of spondyloarthritis, and we want to make sure that we're in line with that current terminology, but also reflective of the patient community. So where most of our original resources were geared towards people with ankylosing spondylitis, and that's still a big part of the community that we work with. We're also here to represent others who have peripheral spondyloarthritis and other forms like psoriatic arthritis and other forms of inflammatory arthritis, including enteropathic arthritis, people with gastrointestinal issues, IBD, Crohn's and colitis related arthritis. So it's a broad spectrum, a broad community, a difficult disease to live with, regardless of what forms people may have. But we feel that by rebranding the organization, we'll be more reflective of that community. So that's something we're really, really excited about. And we're also excited as part of this process to be launching a new website, a redesigned website. So people will still be able to find the resources, the information, the recorded webinars, print, and other materials that we've always had available. But the new website is a modern, fresh design, responsive with all kinds of devices. It's accessible according to the latest standards, and it's a platform that we think will bode well in terms of our mission to connect the community together better than what it has been. So that's part of the reason CSA was founded in the first place, was to bring people together, to share experiences, to help one another as patients. And we feel that the new website and the new brand and this momentum that we're building around that will really help us reach deeper into the community and involve more patients in whatever it is that they're looking for from the organization. If they're coming to us for information, for support, to connect with each other, we have support groups, we have Facebook groups, we have all kinds of different abilities for people to connect with one another and support one another. Or if they're looking for specific information about their disease, if they're in that period in limbo where they're not quite diagnosed, but they suspect that they may have a form of spondyloarthritis, we're here to connect with people regardless of where they are on that patient journey. And we extend that connection as well, not just to patients, but to family members, of course, and healthcare professionals. So as we're, this broadcast is centered around CRA and AHPA. Through organizations like those, we're building partnerships as well that can help connect healthcare professionals, not just with the organization, but with each other and with the information that they're looking for too.
It's so well said. And I think back to your rebrand comment of it's a subtle change. It's subtle, but it is so significant. I think we have to disassociate where a small change can also be extremely significant, extremely meaningful, extremely inclusive, and can make a big impact, even though it's a subtle change. And same thing with having a revamp of your online platform. Again, you can say we're just updating a few things, or make the point that what you're doing is you're better connecting individuals, helping them navigate. The last thing you want to do as a patient is go onto a website that's supposed to help you and then come off and be like, I didn't find the information I needed. I wasted 30 minutes. So I just congratulate you. I congratulate your team. I am excited to check this out.
Thank you. Yeah, we're really excited about it. One other feature I'll mention quickly too is we've been working over the last couple of years with a pharmacist on developing a tool that will allow people to weigh the benefits and risks of different types of arthritis medication through their own lens, through the things that they're concerned about. So this tool is, it's an online interactive tool. It'll be part of our new website. It's not just for people with spondyloarthritis, but really any form of arthritis rather. And it will basically walk people through what their concerns are. And then in the end, it gives you essentially a report that you can use to help make decisions about treatment options that you can take to your healthcare team, your rheumatologist, your GP, and have those conversations and have some information, solid information to help guide those decisions. So that's something that has never been offered before through CSA. We're really excited about that as part of our new website and new brand. And there's lots of great things to come.
Oh, I feel empowered just hearing about this because, of course, I, as a patient, right, it is my job to know what medication's taking, et cetera, but to have a tool to actually walk you through the exact side effects and have something where you can print out and then use that to create more dialogue with a healthcare provider. Yeah, I'm excited. You just let us know how we can share this with everyone living with inflammatory arthritis.
Yeah, that's really, at this point, we're really trying to get the word out about obviously these changes that we're taking forward as an organization, and the new website and new resources, but also about spondyloarthritis as well, in terms of, for example, recognizing the difference between mechanical back pain, which we all have at some point in our lives, particularly as people age, versus inflammatory, which is obviously a chronic arthritic condition that needs to be addressed. And one of the biggest issues facing patients now, if not the biggest issue, is the fact that it takes such an inordinate amount of time for people to be diagnosed. It's in Canada, 7 to 10 years for spondyloarthritis. And it's not just a Canadian issue, it's a global issue that we're working with our partners at the Axial Spondyloarthritis International Federation and others to really bring this to light and come up with real solutions as to how we can address that incredible, unacceptable time to diagnosis. That means that people are, from the onset of symptoms till it's an average of 7 to 10 years. I've spoken to people who have literally lived with AS and other forms of spondyloarthritis for decades before being diagnosed and being told by their own healthcare practitioners that there's nothing wrong. They've done x-rays. It really comes down to a misunderstanding, not just in the public, but also amongst many healthcare professionals as well. Our board chair, Dr. Ali Karam, is a family physician resident right now, and he also is a patient who lives with AS. And even in his case, it took a couple of years for him to be diagnosed. And it's, when you think about that, it really puts it into context. And so he's now joined us as a board member, as our chair, and is really passionate and, I would say, obsessed with this mission to change this. And so that's in addition to what we've always done in terms of being a patient support and information organization and advocacy and so forth. We're also really focusing our strategies on how we can address and working with our partners, working with healthcare professionals and patients to address this unacceptable time to diagnosis, the delay to diagnosis.
Agreed. Absolutely agreed. And I know with your initiative, again, it is in the field of spondyloarthritis, but what it will do is raise awareness for the other more rare, quote unquote, forms of inflammatory arthritis.
Exactly.
We're excited to join you.
Great. That's great. Yeah, it's really, it's going to be, as I said, a team effort with arthritis related organizations, our partners in the field, healthcare professionals, healthcare professional associations. We've recently met with, for example, the Canadian Academy of Sports and Exercise Medicine. They have, I think, about 1,200 physicians who are MSK specialists who are part of that association, obviously CRA, AHPA, other partners. It's really going to be a team effort, and we're really looking forward to working with all of those partners, as well as, of course, the patient community, to bring these issues to light and to come up with real solutions.
Beautiful. Jeff, can I ask, what are the key takeaway messages from your pre-course presentation that will go on Saturday, the AAPH virtual pre-course?
So we're presenting on Saturday, as you said, with AHPA. We have lined up a patient speaker who is a young woman who lives with spondyloarthritis, who is a young mother, young family, and also is a nurse herself, an RN from the Montreal area. And she is going to be sharing her story and her perspective as a patient and as a healthcare provider who is a patient. So it's really exciting to have her there. And that's one of the key focal points of the presentations, is having that patient story there. She talks about some of the issues that we've spoken about a few minutes ago around the delayed diagnosis and frustrations, but also really understanding the complexity of spondyloarthritis and the fact that it's a disease that, as we said earlier, has different forms, but across those, it's complicated. There are many complications that patients experience, obviously pain, but also fatigue and issues around disability and working and healthy relationships and parenting, and all, basically every aspect of life is affected by spondyloarthritis, particularly for those that haven't been diagnosed properly and are not able to benefit from the latest treatments that are available. So we're going to highlight all of those things, and also really hopefully helping the healthcare professionals that are part of this course to understand what we do as an organization, how we support patients, how we can support them in supporting their patients, how to refer people to us. That is a key takeaway as well.
I'm very excited for the presentation. And then my next question is, this year's theme, big words, reconnect, renew, and reimagine. So that is the overarching theme. In your opinion, how can everyone in the healthcare system, whether that's patients, care providers, healthcare providers, as well as, people who are in the decision-making table, how can we promote innovation and how can we promote more equitable care to those, like you said, who have a delayed diagnosis?
I think it's one thing that comes to mind immediately is the importance of the patient voice in all of this, and I mean that both in terms of we think of advocacy as big picture often. So there's for example, there's a new biologic or some great innovative treatment option that has been approved and we're for use in Canada. We're trying to help move it along the process so that ultimately Canadians can have the best possible options available to them and that prescribers have the best possible options for their patients. But advocacy also is about self advocacy too. So one of the things that we do, and we're going to be talking a lot more about, I think, going forward, is helping people advocate for themselves because patients have to do that. It's something that people don't necessarily think is their role, but it absolutely is. Patients, their caregivers, family members have to advocate for their own care. So I think having reimagining in that sense and looking at the role of advocacy as not just those big uh, picture issues around the healthcare system or access and so forth, but what does that mean to an individual who's a patient who is struggling to be diagnosed or to understand their disease and find the best treatment options that are available to them? There is no one treatment option that works across the spectrum, of course. So for different people, effective treatments are can look quite different. And so people need to really understand that and advocate for themselves. I think it's also about when we think about reconnecting and renewing, we've talked about CSA's branding and changing our name of the organization. That's all about renewal to me and reconnecting in some cases, or connecting with people who haven't been connected to the organization, whether they be patients, healthcare professionals, other patient organizations. We really, really take that seriously. And really, when we say we're building partnerships, we are actively looking for organizations, for healthcare providers and others to come along with us on this journey and to be champions for patients as well.
So powerful. And, reflecting on our conversation, what I just realized was your message about this advocating for oneself or self-advocacy, right? What CSA does is it provides the education, the tools, and the support to help people help themselves. Because in a perfect system, we could have enough healthcare providers just provide care, call you every single day, check in, but that's not the case. So the next best option is to empower those. And I see everything so clearly, and I'm, as I said multiple times, very excited for your presentation. Very excited to see the new website.
Thank you. Yeah, no, and when you think about it, it's a big part of what CSA has always done, and other organizations do as well, very well, is bringing people together to support one another. And so when we think about self-advocacy, that's a big part of it too, is having patients providing their perspective to other patients, even though every patient's journey and the way disease affects them could be different. There are some key principles that people learn from in talking with other patients. So we offer a number of different ways for that. There's obviously information that people can access readily through our website, but there's also opportunities to connect with people. So for some people, maybe a Facebook group is a good way to do that. And so we often get people asking questions like, I have an appointment with my rheumatologist next week. Here's something I'm concerned about. What do you guys think? And then you'll get any number of people weighing in. It's not medical advice. I want to say that right off the top. We don't encourage people to provide medical advice to one another, but just how to talk about your disease, how to position things, what to say to make sure that your message is getting through. Those are things that we can help patients with. And when I say we, I mean not just CSA, but CSA is the patient community, if that makes sense. And so that's where our role is to bring those people together and to give them a platform to be able to do that.
Wonderful. And To everyone listening, if you are interested in connecting with CSA, to checking out the resources, we're going to link them below this recording. And with that, Jeff, I just want to thank you for your time. I want to thank you for your work, and really looking forward to more in the future.
Thank you so much. I want to thank you, Ellen, and your colleagues for giving us this opportunity and this platform to share our message. We are really excited to be involved in the AHPA course this year, and also attending CRA as well. So it'll be great to connect with everyone. And please, for anyone out there that sees this or hears these messages, we encourage you to just reach out in whatever way, whether it's through social media, through visiting our website. We have a toll-free number for those that like a good old-fashioned phone call instead. We want to connect with people, so we encourage everyone to take that step and do that.
Thank you. And with that, everyone, we hope to see you at the next episode of CR Arthritis at the 9th Annual CRA Rheumatology Conference. Goodbye. Take care, everyone.
Thank you. Bye.